You know that feeling maybe after a big meal where you get that uncomfortable burn creeping up? We've all been there, I think.
Yeah, definitely.
Well, today we're digging into something kind of similar, but it's happening in our dogs and cats. We're talking about gastroesophageal reflux, or GER.
Exactly. And our mission today really is to unpack what GER actually is in pets. What causes it? How do vets figure it out?
And crucially, what can be done about it? We're drawing on veterinary insights here.
Right. We want to give you, the listener, the key information if you're maybe seeing signs that worry you about your own pet.
Yeah, and this isn't about drowning you in, complex medical terms. We're pulling out the need-to-know stuff.
Hopefully giving you some of those aha
Yeah.
moments about your pet's health. We've looked at some solid veterinary sources that break this condition down.
Which might actually be more common than people realize. Okay, so let's jump in. What fundamentally is gastroesophageal reflux?
Okay, so simply put, it's when fluids from the stomach or even the intestines flow backward, up into the esophagus.
The tube leading to the mouth, right? So stuff is going the wrong way.
Precisely. Taking an upward detour it shouldn't be taking.
Doesn't sound pleasant. Now, here's something I found interesting. A little bit of this is actually normal in dogs and cats.
That's right, yeah. It might be surprising, but occasional minor reflux isn't necessarily a problem. It can happen.
Okay, so when does it become a problem?
The issue really starts when it happens frequently or for, extended periods, because the stuff coming up,
Like stomach acid.
yeah, stomach acid, pepsin, bile salts, other digestive fluids, they're quite harsh. They can really irritate the lining of the esophagus.
Ah, so it's that prolonged contact. That's the damaging part.
Exactly. Over time, that irritation causes inflammation. We call that esophagitis.
Esophagitis. And that can vary, right? Like how severe it gets.
Absolutely. It can range from just, some mild redness on the surface,
Okay.
all the way to quite severe ulcers that go much deeper into the esophageal wall.
Wow, okay, so we know what it is and why it's a concern. Who does this typically affect? Are certain pets more at risk?
Well, generally speaking, GER can pop up in any dog or cat. Doesn't really matter the specific breed or sex most of the time.
But there are some connections.
There are. One interesting link is with something called congenital hiatal hernias.
Okay, what's that?
That's where part of the stomach actually pushes up through the diaphragm, that muscle, separating the chest and abdomen into the chest area. It's something they're born with.
And that's seen more in certain breeds?
Yes, particularly in Chinese Sharpies.
Mm.
And also in other brachycephalic breeds.
Brachycephalic. Those are the ones with the shorter, sort of pushed-in faces, like pugs, bulldogs.
Exactly. Their anatomy, just how they're built, can sometimes make them more prone to reflux issues.
That's really interesting. What about age? Does that play a role?
It can happen at any age, really, but
Yeah.
younger animals might have a slightly higher risk.
Oh, why is that?
Well, the muscle at the bottom of the esophagus, the lower esophageal sphincter,
Hmm.
its job is to stop that backflow. In very young animals, it might not be fully developed, not quite as strong yet.
Makes sense. And I guess that risk is even higher for young pets if they also have one of those congenital hiatal hernias we mentioned.
Definitely. That combination puts them at increased risk, for sure.
So thinking about us owners at home, what signs should we be watching for? What might suggest it's more than just, a tiny bit of normal reflux?
Good question. One key thing is regurgitation.
Which is different from vomiting.
Yes,
Yeah.
very different. Regurgitations is often more passive. You don't usually see those big abdominal heaves like with vomiting. It just sort of comes up.
Okay, what else?
Excessive drooling is another sign. Hypersalivation, we call it. Also, if they seem to find swallowing painful or difficult.
Odynophagia.
That's the term, yes, odynophagia. And sometimes just a general loss of appetite, anorexia. They just don't want to eat.
And if you take them to the vet, what might the vet notice during an exam?
Often the physical exam can be pretty normal, especially in milder cases.
Really? So not always obvious.
Not always. But if it's one of those brachycephalic breeds, the vet might see other signs related to their conformation, which kind of ups the suspicion for reflux.
Okay.
In more severe GER cases, though, the vet might indeed see that hypersalivation, the excessive drool. And sometimes the pet might even react, show pain, if the vet gently palpates or touches the neck area over the esophagus.
So paying attention to those subtle behavior changes at home is really important then.
Absolutely crucial. Okay, so we've covered the what and the who. Let's maybe dig into the why. What actually causes GER or increases the risk?
Yeah, what are the triggers?
Well, several things can contribute. Anesthesia is a big one.
During surgery, you mean?
Yeah. The drugs used can relax that lower esophageal sphincter muscle, making it easier for stomach contents to flow back up.
Okay, that makes sense.
Also, anything that causes food to stay in the stomach longer than usual retain gastric contents that can increase pressure and risk.
Like if their stomach isn't emptying properly for some reason.
Exactly. And then there's foreign bodies. If a pet swallows something that gets stuck or just irritates the esophagus,
The inflammation could lead to reflux.
it certainly can. We call that esophagitis, and it could definitely disrupt normal function.
Any other common culprits we should know about?
Yes, actually, especially for cat owners. Giving certain pills, particularly some antibiotics like tetracyclines or doxycycline,
Mm-hmm.
if those pills get stuck or dissolve in the esophagus, they can cause quite a bit of irritation, leading to esophagitis and potentially reflux.
Wow, that's very specific. Good to know for cat owners.
Very. And we already mentioned hiatal hernias, both congenital and acquired ones that develop later. And finally, just chronic vomiting itself.
Even if the vomiting is caused by something else entirely.
Right. The act of vomiting repeatedly can irritate the esophagus over time, potentially creating a vicious cycle of inflammation and reflux.
Okay, this gives us a much clearer picture of the potential triggers. Now, diagnosis. If a vet suspects GER, how do they confirm it? It sounds like the signs could point to other issues too.
You're absolutely right. Diagnosis isn't always straightforward. And, frankly, we probably underdiagnose GER. It might be more common than the records show.
Because the symptoms are a bit vague sometimes.
Exactly. The vet has to consider a list of other possibilities, what we call differential diagnoses.
Like what sort of things?
Oh, things like problems in the mouth or throat making swallowing hard. Maybe they ingested something corrosive, or there's a foreign object, or even a tumor in the esophagus.
Okay.
Or other conditions like megaesophagus, where the esophagus is enlarged and doesn't move food properly, or maybe even a hiatal hernia, or something called an intussusception, where part of the GI tract telescopes into another.
So ruling those out is step one.
It's a critical part of the process, yes. You need to be sure you're treating the right thing.
What about standard tests like blood work or x-rays? Do they usually show GER?
Generally, no. Basic lab work, CBC, biochemistry, urinalysis is usually normal in pets with GER.
Okay. And x-rays.
Routine x-rays are often unremarkable too. Sometimes you might see a bit of air in the esophagus, but that's not very specific. It could be there for other reasons.
So not super helpful for spotting GER itself.
Not usually for the reflex itself. Now, contrast studies, where the pet swallows barium liquid.
The stuff that shows up white on x-rays.
Right. Those can sometimes show reflux happening, especially if you use video fluoroscopy, basically a moving x-ray movie. But even then, it's not guaranteed to catch it.
Still might miss it.
It might. What x-rays can be useful for, though, is spotting complications, like if the pet has inhaled some reflux material into their lungs and developed aspiration pneumonia.
Ah, okay. So if standard x-rays aren't great for seeing the actual irritation in the esophagus, is there a better way, a gold standard?
Yes, there is. Esophagoscopy is really considered the best way to diagnose reflux esophagitis.
And that involves?
It involves using an endoscope, a thin, flexible tube, with a camera on the end inserted down into the esophagus.
So the vet can see inside directly.
Exactly. They can visually inspect the lining, look for redness, any bleeding points, check for pooled liquid or secretions down near the stomach. They can also see if that lower esophageal sphincter looks abnormally open or relaxed.
That sounds much more definitive.
It gives the most accurate picture of any mucosal damage, that inflammation or ulceration we talked about, which just doesn't show up well on regular x-rays.
Okay, got it. So esophagoscopy gives the clear diagnosis. Let's shift to treatment then. If a pet is diagnosed with GER, what's the plan?
Well, the good news is it's usually managed on an outpatient basis, meaning the pet can be treated at home.
No need for hospitalization, typically.
Not usually, unless it's extremely severe or there are complications. And strict activity restriction isn't usually necessary either.
What's the first step in management?
For moderate to severe cases, the vet might suggest withholding food for maybe 24 hours initially.
To give the esophagus a rest.
Exactly. Let it calm down a bit, minimize further irritation. After that, diet becomes really, really important.
Okay, what kind of diet?
Typically, the recommendation is for a diet that's low in both fat and protein, and feeding it in small, frequent meals throughout the day.
Small, frequent meals make sense, less volume in the stomach at once. But why specifically low fat and low protein?
Great question. So, dietary fat tends to do two things we don't want here. It can lower the pressure in that lower esophageal sphincter, making reflux easier.
Oh, makes it looser, kind of?
Right. And fat also slows down stomach emptying, so food sits there longer, increasing the chance of reflux.
Okay, and the protein.
Protein stimulates the stomach to produce gastric acid. And since acid is a major irritant we're trying to deal with, reducing that stimulation helps.
Gotcha. So diet is a cornerstone. What about medications?
Yes, medications are definitely part of the plan. One common one is sucralfate. It usually comes as a liquid or a slurry.
What does that do?
It essentially forms a protective coating over any inflamed or ulcerated areas in the esophagus, like a bandage on the inside, helping it heal.
That sounds helpful. Anything to watch out for with sucralfate?
Yes, it's important to know it can interfere with the absorption of other oral meds if given at the same time. So you need to time the dosing carefully relative to other drugs.
Good tip. What other types of meds are used?
Gastric acid inhibitors are key. These reduce the amount of acid the stomach makes.
Less acid means less irritation if reflux happens.
Precisely. There are two main types, H2 blockers, like ranitidine or famotidine,
Okay.
and proton pump inhibitors, or PPIs, like omeprazole or pantoprazole. Both work differently, but aim to reduce acid production. They come in oral and sometimes injectable forms.
Are there drugs to help the stomach empty faster, too?
Yes, those are called prokinetic agents. Metoclopramide is one, cisapride is another, though it can be harder to get sometimes. Ranitidine, one of the H2 blockers, actually has some prokinetic effects too.
So they help move food out of the stomach quicker.
Exactly. Less time for it to reflux back up. Metoclopramide can even be given as a continuous drip, an IV infusion, in hospitalized cases if needed.
So it sounds like a combination approach: diet and often multiple medications. What about follow-up? How do you know if it's working?
That's mostly based on monitoring the clinical signs. Is the regurgitation stopping? Is the pet eating better? See more
So
comfortable?
you don't usually need to repeat the endoscopy.
Not routinely, no. Only really if the pet isn't getting better with the initial treatment plan. Then a repeat scope might be needed to see what's going on.
Are there any serious complications to be aware of?
The main one to worry about with severe chronic esophagitis is the potential development of an esophageal stricture.
A stricture? What's that?
It's a narrowing of the esophagus caused by scar tissue forming as the severe inflammation heals. It can make it very difficult for food to pass down.
That sounds serious. So prompt and effective treatment is important to try and prevent that.
Absolutely. And long-term management often involves sticking to those dietary recommendations.
Especially avoiding high-fat foods.
Definitely. That's a key piece of advice. High-fat treats or foods can really sabotage the treatment.
And what about that pill advice for cats?
Oh, yes, really important. Whenever giving a cat a pill or capsule, always follow it up with a little bit of water, maybe from a syringe, or even a bit of tasty liquid or food.
To wash it down properly.
Exactly. Make sure it doesn't sit in the esophagus and cause that local irritation that can kickstart problems.
This has been incredibly informative. So just to quickly summarize, GER in pets is when stomach contents flow back into the esophagus, causing irritation and inflammation.
Right. It might be underdiagnosed, and signs include things like regurgitation, drooling, maybe painful swallowing, poor appetite.
And diagnosis often relies on that direct look with esophagoscopy because x-rays aren't always helpful for seeing the lining.
Correct. Treatment then focuses on diet, low fat, low protein, small meals, and medications to reduce acid, protect the lining, and sometimes improve motility.
Like sucralfate, acid blockers, and prokinetics.
That's the core of it.
So for you listening, if any of these signs sound familiar for your dog or cat, this hopefully gives you a good starting point for a chat with your vet.
Absolutely. Always the best course of action if you're concerned. Professional advice is key.
Definitely. And, it does make you wonder, given that maybe minor transient reflux is fairly common, what subtle little changes in our pet's behavior, maybe just seeming a tiny bit off after eating, or a little lip licking might we be overlooking, that could, over time, signal a bigger issue brewing?
That's a really interesting thought, something to keep observing, for sure.